Today, we'll look at the subjects of hands and wrists. Our hands are truly the ultimate machines, a collection of intricate pulleys and levers and muscles that provide us to do many things, from sports to work to everyday tasks we rarely give another moment's thought to. There are many ways in which our hands can be compromised, and at Hekin Orthopedic Specialists, we're equipped to handle all of them. Dr. Chris Goll is a fellowship-trained orthopedic surgeon specifically trained in reconstructive surgery of hands and fingers and advanced carpal tunnel syndrome. Dr. Goll began his training as a mechanical engineer at the University of Florida. He continued through medical school and later worked for the Mayo Clinic in Rochester, Minnesota.
As an orthopedic hand surgeon, I take care of basically the range from the fingertips to the elbow. And within that area, there is truly an endless number of conditions that we take care of. The primary groups of conditions are the arthritic conditions, the painful conditions, nerve compression disorders, things like carpal tunnel syndrome and cubital tunnel syndrome, which are fancy words for nerves are too tight in places and they're making people's hands go numb and they're making their fingers hurt and they wake up in the middle of the night. It's so frustrating. But additionally, there's a whole field of orthopedic hand trauma. The fingers have been getting caught in things for millions of years, and lacerations, fractures, crush injuries, burns are all part of the things that I take care of as an orthopedic hand surgeon.
As people age, arthritis can become an increasingly limiting condition, but there are a range of treatment options to consider that can restore your quality of life.
Well, there are two main categories of arthritis that we typically speak of. Osteoarthritis is the wear and tear type arthritis, and rheumatoid arthritis is actually an autoimmune disease where the body's own immune system attacks it. Both of these can create very similar problems in the hand though. Probably the most common area that I see arthritis affect the hand is at the base of the thumb. And most people remember back from their science class that the thumb is what separates us from the rest of the animal world and allows us to do so many different things. But it only works if all the joints within that thumb work. And the base of the thumb is probably the area that gives people some of the most trouble. The joint right at the bottom of the thumb. Any public place you go, the theater, your church, your synagogue, you'll see people kind of doing this. This is the signal that you're in the club with the thumb arthritis. And it's just a throbbing type pain, and when you go to open a jar or turn a stiff knob, it can be a really sharp pain. And my ability to treat that comes in several forms. Most of them are non-operative things that I can teach you how to use your hands differently, things that I can recommend around your house to make dealing with thumb arthritis much easier. And then we kind of move up a treatment ladder, things like medications, things like injections, occasionally some therapy. And then finally, if all of those things don't provide the relief we're looking for, then we'll move on to a surgery. And I have a surgery where we can basically remove the arthritic tissue from the joint by taking out one of the bones and replace that with some of your own tissue from a tendon that's in the forearm. And it is a surgery that we've been doing for probably over 50 years now with some modifications, and it works very well.
Dr. Goll says that the most common condition that he sees is carpal tunnel syndrome. And while this condition is often misunderstood and misdiagnosed, treatment for it has proven extremely effective.
One of the disorders that I probably take care of most commonly is carpal tunnel syndrome, and maybe slightly behind that is its unfamous cousin, cubital tunnel syndrome. There are essentially three nerves that give the feeling to the hand. On the front of the hand, primarily that's down to two nerves. And the one that probably gives folks the most trouble is the median nerve. And the median nerve runs up the front side of the wrist, runs through the carpal tunnel, and basically feeds the thumb, the index, the long, and part of the ring finger. So it's this kind of large half, or slightly, maybe 70% on the thumb side of the hand that's affected in carpal tunnel. And what happens is that this median nerve, as it runs through this space, gets impinged, which decreases its blood supply and just makes it not function. And the symptoms of that are you're driving down the road and your hands go numb. You're blow drying your hair and your hands go numb. You're talking on the phone and your hand goes numb. You wake up in the middle of the night, you're shaking your hand out trying to get it to wake up. This is usually carpal tunnel syndrome. There are some other things that act like it, and it's my job to kind of figure out, could this be a pinched nerve at the neck, or could this be some neuropathy from diabetes or something like that. And there are some ways that I use to figure that out. Most of the time it's on physical exams. Sometimes we'll do some injections. Sometimes we use nerve conduction studies. All of these tools will help us find the spot where the problem's coming from. When we identify that, then we can talk about treatment options. There are basically 3 things that work for carpal tunnel syndrome. In mild cases, wearing a splint at night often gives people very good relief and lets them get a good night's sleep. Next on the ladder, we typically will try a cortisone injection. These have been used for a long time and they work really well. Frustratingly, they don't always work permanently. And we don't like to put a lot of cortisone in a space around nerves and tendons repeatedly. And so typically, if we can't get that permanent response that we would like to have, then what we'll do is we'll move on and talk about carpal tunnel surgery. Carpal tunnel surgery is probably one of the most effective treatments in medicine. If you identify someone who is suffering with the symptoms of carpal tunnel and you identify that that's where the problem is, with a surgery that takes between 5 and 10 minutes to do in an outpatient setting under local anesthesia and a little twilight sedation, we can go down and divide the ligament that's squeezing down on the nerve and take the carpal tunnel from being a tight space like this to an open space. And people tell me that the night of their surgery was the best night's sleep they've had in years. It's a surgery that people recover from quickly. For people that do desk jobs, often I'll do their surgery on a Friday and they go back to work on Monday. For people that are laborers or use their hands in a heavy capacity, sometimes it's a couple of weeks. But it's a surgery that can truly save the function of the nerve. And I'm always frustrated when I see people that have been so busy working or so busy taking care of other things in their life that they just live with the numbness and tingling and they tolerate it because it's not always that painful. The frustrating thing is that the longer people suffer with this, the less that I can bring back with the surgery. It's not that it doesn't help, it's just I wish I would have seen them 5 years ago. I wish I would have seen them 10 years ago because I would like to give them the best outcome.